Bismillahirrahmanirrahim. Today we will discuss some MCQs on rheumatoid arthritis. So question number 1. What is the principal infiltrating cell in patient with rheumatoid arthritis? And we have already discussed in the lecture of rheumatoid arthritis that the T lymphocyte is the principal infiltrating cell in the patient with rheumatoid arthritis. So option C here is the correct answer. That is why the condition in which the T lymphocyte is decreased, if this patient is also having the rheumatoid arthritis, his or her rheumatoid arthritis will improve, like it in advanced HIV, in which the T lymphocyte decreases, rheumatoid arthritis will improve. Question number 2. Which of the following cytokine is the most important in the pathophysiology of rheumatoid arthritis? So we know that there are three cytokines which are important in the pathophysiology of rheumatoid arthritis. The most important one is the tumor necrotic factor. The second one is the IL-1, and the third one is the IL-6. So tumor necrotic factor is the most important cytokine which is responsible for the pathophysiology of rheumatoid arthritis. That is why we give some drug which will inhibit the TNF, that is the anti-TNF drugs, and we give the drug like the anakinra, IL-1 antagonist, and we give the drug which will inhibit the IL-6 like tocilizumab. So the most important cytokines which are responsible for the pathophysiology of rheumatoid arthritis is the TNF. TNF is the important cytokines responsible for the pathophysiology of rheumatoid arthritis. Question number 3. Which of the following HLA is associated with rheumatoid arthritis? And we know that HLA-DR4 is the HLA which are associated with the rheumatoid arthritis. So option E is the correct answer. Question number 4. Which of the following describe rheumatoid factor? Rheumatoid factor is actually IgM against the Fc portion of IgG. So option E is the correct answer. And we know that rheumatoid factor is neither a sensitive nor a specific test. It is positive in 70% of the cases of rheumatoid arthritis. This is neither a sensitive nor a specific test because there are some other conditions other than rheumatoid in which the rheumatoid factor is positive, and this condition can be remembered by the mnemonic she, feel, in love with general system. She mean Sjogren syndrome, feel mean Pilty syndrome, IN means infective endocarditis, love means lupus, systemic lupus erythematosus, general means 5% of general population, and system means scleroderma. So these are the conditions in which the rheumatoid factor will be positive. Question number 5. Which of the following is the most specific antibody for rheumatoid arthritis? And we know that anti-CCP is the most specific antibody for the rheumatoid arthritis, and it is 95% specific. Anti-CCP also indicate a poor prognostic factor in the rheumatoid arthritis. Question number 6. Which of the following score is used for monitoring disease activity in rheumatoid arthritis? CURP 65 is used for the pneumonia. CHEDWA score is used for the atrial fibrillation. DAPSA score is used for the psoriatic arthritis. True love and Witt's criteria is used for the inflammatory bowel disease. So option E is the correct answer. Disease activity score 28 is used for the rheumatoid arthritis. Disease activity score 28 is CRPs and disease activity score 28 ESR. These scores are used for the rheumatoid arthritis. If the score is more than 5.1, this is an indication for the biological demand. Question number 7. Rheumatoid arthritis causes which of the following type of arthritis? So we know that rheumatoid arthritis causes erosive and deforming arthritis. So option E is the correct answer. What is the difference of arthritis of SLE and arthritis of rheumatoid arthritis? So rheumatoid arthritis, SLE comparison. It causes erosive and deforming arthritis, while it causes non-erosive and non-deforming arthritis. This is the difference between arthritis of SLE and arthritis of rheumatoid arthritis. Question number 8. Which of the following joints are not involved in rheumatoid arthritis? So we know that it does not involve the distal interphalangeal joint and it does not involve the lumbar spine and sacroiliac joint. So option E is the correct answer. The most common joint involved in the rheumatoid arthritis is the metacarpophalangeal joint, but it does not involve the distal interphalangeal joint in the hand, and it does not involve the lumbar spine joint, and also does not involve the sacroiliac joint. Joint not involved are DIP joint, lumbar spine joint, and sacroiliac joint. These joints are not involved in the rheumatoid arthritis. Question number 9. What is the most common extra-articular manifestation of rheumatoid arthritis? The most common extra-articular manifestation of rheumatoid arthritis is the rheumatoid nodule. This is the most common extra-articular manifestation. Rheumatoid nodule can occur anywhere, but it is most commonly occur on the extensor surfaces of the joint and tendon. It can occur in the lungs. If it occur in the lungs and the patient is also having the pneumoconiosis, this is called the Kaplan syndrome. Kaplan syndrome. Rheumatoid nodule in the lung plus pneumoconiosis. This is called the Kaplan syndrome. Question number 10. Which of the following is the most common ocular manifestation of rheumatoid arthritis? So all of these are the ocular manifestation of rheumatoid arthritis, but keratoconjunctivitis sicca is the most common one. So option A is the correct answer. Rheumatoid arthritis can cause keratoconjunctivitis sicca. It can cause scleritis. It can cause episcleritis. It can cause keratomalacia. And patient taking hydroxychloroquine can cause retinopathy. But out of these, keratoconjunctivitis sicca is the most important one and the most common one. Scleritis is painful. Episcleritis is painless. This is the most common. Question number 11. A known case of rheumatoid arthritis patient present to you with dyspnea. You did pulmonary function test which show FEV1 to FVC ratio less than 70, means obstructive pattern. Which of the following best fit with the above PFT result? So we know that pulmonary manifestation of rheumatoid arthritis include pleuritis, pleural effusion, pulmonary fibrosis, bronchiolitis obliterans, and it can also cause pneumonitis. But out of these, pulmonary fibrosis will present with the restrictive pattern on the pulmonary function test, and bronchiolitis obliterans will present with the obstructive pattern on the pulmonary function test. So FE1 to FEC ratio less than 70 indicate that this is obstructive pattern. So option C is the correct answer. This patient has bronchiolitis obliterans, which is the obstructive pattern on the pulmonary function test. Question number 12. What is the most common cause of death in rheumatoid arthritis? The most common cause of death in rheumatoid arthritis is the cardiovascular cause. And this is due to accelerated atherosclerosis. Accelerated atherosclerosis. Atherosclerosis. What is the most common cause of anemia in rheumatoid arthritis? And we know that rheumatoid arthritis is a chronic inflammatory condition, and any chronic inflammatory condition are associated with the anemia of chronic disease. So anemia of chronic disease is the most common cause of anemia in patients with rheumatoid arthritis. But rheumatoid arthritis can also cause the iron deficiency anemia. This is due to chronic NSAID use. Chronic NSAID use. Necrocytic anemia due to folic acid deficiency can also occur in the rheumatoid arthritis because of the methotrexate use. Methotrexate will cause folic acid deficiency. Autoimmune hemolytic anemia is also associated with the rheumatoid arthritis, and pernicious anemia can also occur in the rheumatoid arthritis. So the causes of anemia in rheumatoid arthritis include anemia of chronic disease. This will be the most common one. Iron deficiency anemia occur due to chronic NSAID use. NSAID will cause erosion of the gastric mucosa, and chronic bleeding will lead to iron deficiency anemia. Macrocytic anemia due to folic acid deficiency occur due to methotrexate. Macrocytic anemia can also occur due to B12 deficiency, due to associated pernicious anemia, because we know that pernicious anemia is autoimmune anemia, and one autoimmune condition is associated with other autoimmune condition. Autoimmune hemolytic anemia can also be associated with the rheumatoid arthritis, and bone marrow suppression can also cause anemia due to DMARD use. Bone marrow suppression. Like methotrexate can cause bone marrow suppression, and this will cause the cytopenias. So these are the causes of anemia in rheumatoid arthritis, but the most common cause of anemia in rheumatoid arthritis is the anemia of chronic disease. Question number 15. A known case of uncontrolled rheumatoid arthritis present you with bilateral lower limb pitting edema and periorbital swelling. 24-hour urinary protein show 3500 gram proteins, means nephrotic range proteinuria. Echo in LFTs are normal. What is your diagnosis? So this patient presented with the bilateral lower limb pitting edema and periorbital swelling. And when you did the 24-hour urinary quantification, it showed nephrotic range proteinuria. So this patient has developed nephrotic syndrome. Nephrotic syndrome. And when you did the echo, it was normal. So cardiac causes is ruled out. And when you did the LFTs was also normal. So the hepatic cause is also excluded. And we know that chronic inflammatory conditions are associated with the amyloidosis, secondary amyloidosis. So this patient has renal amyloidosis, which has causes the nephrotic syndrome. So option E is the correct answer. Question number 14. A 48-year-old male known case of rheumatoid arthritis present to you with complaint of sudden development of painful swollen calf. What is your diagnosis? So we know that when rheumatoid arthritis patient present with the calf swelling, if the patient is rheumatoid arthritis and present with the calf swelling, then the diagnosis should be rupture Baker cyst. And when the patient is SLE and present with the calf swelling, then your diagnosis should be a DVT. So option E is the correct answer here. Question number 16. A 27-year-old female present to your clinic with pain and stiffness in the MCP, PIP and wrist joint of both hands. You sent NTCCP and ESR and CRP. Results show positive NTCCP and raise ESR and CRP. You advise X-ray of the hand joint. Which of the following will be present on radiograph? So this patient fulfill the diagnostic criteria of rheumatoid arthritis. NTCCP is positive, ESR and CRP is positive. This question is asking that this patient has rheumatoid arthritis, so you advise X-ray of the hand joint. What will be present on the X-ray of the hand joint? So we know that X-ray finding in rheumatoid arthritis, early finding and late finding. Early finding will show soft tissue swelling, loss of joint space, and juxta-articular osteopenia. Juxta-articular osteopenia. These are the early finding. Late finding include the erosion and subluxation. So out of these five, juxta-articular osteopenia is the correct answer. On the radiograph, there will be juxta-articular osteopenia. Question number 17. A newly diagnosed patient of rheumatoid arthritis with morning stiffness and pain in the MCP, PIP and wrist joint. NTCCP is positive. Which of the following is the best treatment to slow progression of disease? So this patient is rheumatoid arthritis. And the question is asking that what is the best initial treatment for this patient? We know that the best initial treatment for this patient is the bridging therapy, which will include the methotrexate and prednisolone. This is called the bridging therapy. So the best initial treatment is the bridging therapy, including the methotrexate and prednisolone. Prednisolone is given for a short period, for at least 2 weeks, and methotrexate is then continued. So option E is the correct answer here. What is the antidote for the methotrexate? The antidote for the methotrexate is the polinic acid, also called the leucovorin. Leucovorin. So this is the antidote for the methotrexate. Misnai here is for the cyclophosphamide. Cyclophosphamide. Question number 19. A known case of rheumatoid arthritis on methotrexate presented to your clinic with signs and symptoms of urinary tract infection. You decided to start antibiotic treatment. Which antibiotic is contraindicated when the patient is taking methotrexate? So we know that when a patient is taking methotrexate, then another folic acid antagonist should be avoided. So out of these five options, option E is the correct answer here. This drug should be avoided if the patient is already taking methotrexate, because cotrimoxazole is also an antipolar drug, and methotrexate is also antipolar drug. If both the antipolar drugs are combined, it will cause the bone marrow suppression. So cotrimoxazole should be avoided in this patient. Question number 20. Which of the following demand is safe in pregnancy? Leplonamide, this is not safe. Methotrexate is not safe. Rituximab is not safe. Anti-TNF is not safe. Option E is the correct answer. Sulfasalazine is the safe demand for the pregnancy. Safe demand in pregnancy include the hydroxychloroquine, sulfasalazine, and if inflammation are not controlled with the hydroxychloroquine and sulfasalazine, you can give the azathioprine. So these are the safe demand in the pregnancy. Question number 21. A known case of rheumatoid arthritis is starting on HCQ, mean hydroxychloroquine. Which of the following is most important to monitor? So we know that hydroxychloroquine can cause the retinopathy. So visual acuity is the correct answer, and this is monitored annually. Question number 22. Question number 22. A 38-year-old male, known case of rheumatoid arthritis, has been switched from methotrexate to leplonamide. Monitoring of CBC LFTs has been arranged. What else should be arranged to monitor? We know that leplonamide is a teratogenic drug. It also causes the hepatitis and bone marrow suppression, but it also causes the blood pressure. So we have also to monitor the blood pressure in patient taking the leplonamide. Question number 23. A 50-year-old female presents with joint pain and stiffness and swelling in her hand. She has a background of asthma, hypersensitivity to aspirin and NSAID, which causes angioedema. Which of the following drugs are contraindicated? So this patient has hypersensitivity to aspirin and NSAID. And if there is hypersensitivity to aspirin, then the sulfur containing drug should be avoided, like sulfasalazine. If the patient is already allergic to aspirin, Then this patient may also be allergic to the sulfur-containing drug like the sulfasalazine. So sulfasalazine should be avoided in patients who are allergic to aspirin. So option E is the correct answer here. Question number 24. A 52-year-old female, known case of rheumatoid arthritis, responded poorly to combination of methotrexate and levodopa for 5 months. You plan to start her on anti-TNF. Which test is done before starting anti-TNF drugs? So this patient is using methotrexate and levodopa for more than 5 months, and their disease is not controlled with the combination of methotrexate and levodopa. Indication of anti-TNF. When two synthetic demand is not working for more than 3 months and the disease activity score is -28 score is more than 5.1, then you have to use the anti-TNF. But before starting the anti-TNF, you have to screen the patient for the latent tuberculosis because anti-TNF drugs can reactivate the latent tuberculosis. So out of these 5 options, option B is the correct answer, which is used for the screening purpose for the latent tuberculosis. Question number 25. Which of the following is associated with good prognosis in patients with rheumatoid arthritis? Poor prognostic factor in patients with rheumatoid arthritis. It includes the insidious onset, female sex also has poor prognosis, rheumatoid arthritis factor positive also have poor prognosis, anti-CCP positive also have poor prognosis, HLA-DR4 positive also have poor prognosis. So if the rheumatoid factor is negative, it will have good prognosis. So option E here is the correct answer. Thanks.